Do you see something we can overcome in the next decade or so to see a lot more successful entrepreneurs like you in the biologic space, in a sense, being able to maybe straddle that cross-border innovation pipeline that has not been easy?
Yeah, so I think you ask a very important question, Prashanth, and I think if I was to answer that, I would start with the ecosystem. You keep referring to the US ecosystem.
Right.
And the US ecosystem is a self-perpetuating virtuous cycle, which is really about having VCs backing ideas. Those ideas being taken to the stock markets.
Yeah, very early. I mean,
very early,
immediately after your phase 2.
Yeah, and investors being excited with early stage development. Unfortunately, we don't have that ecosystem, and of course, the government also has played a very important role in making sure that they're part of the ecosystem, because a lot of these early stage ideas are emanating out of academic research.
Right.
And academic research is always bolstered by a lot of NSF funding, NIH funding, and a lot of the the clinical development takes place with a lot of this kind of support. Now, unfortunately, in India, we've kind of made two silos of private research and public research.
Understood.
And that is, I think, very unhealthy. And, the private research is viewed with a lot of suspicion and with a lot of resistance, I would say, for funding, for government funding. And public research is basically supported with a lot of funding, but it doesn't connect with private sector
the translation
in terms of translating that research into a commercially viable idea or a product. So I think we have to first fix that. Secondly, I think VCs in India and investors in India have been very spoilt by very quick returns.
Yeah. In very low hanging fruit to their opinion.
Because they all want to back low risk ideas. So services companies do very well because there's no risk of the returns, right?
And
because
immediate consumer kind of applications and consumer.
No, but even in services, if you ask me, whether it's a diagnostic center or a research services company, it's about getting more business and
that everybody's comfortable.
And there's no losses being mounted, right? If you look at novel companies, the investment needs for developing novel molecules is so high that it's like a bottomless pit in terms of investment in the early stage. And you don't see your return for several years, which is not what VCs here are used to. So they want to see quick returns, and those quick returns are not visible for the foreseeable future. So what happens is most of these companies finally give up, or they basically take their ideas to the US.
Right.
And then they develop and shape those ideas in the US and they raise capital. And I'll give you an example. I myself spun off a very interesting company based on a very novel asset that we had developed in-house in Biocon. But we realized that developing it in India was not going to be the right thing to do, because we would not be able to raise capital. It would hit our P&L. And it didn't make sense. So what did we do? We spun off a company in Boston called Bicara Therapeutics, and we parked all this asset and IP in that company. And of course, this company has managed to raise a lot of capital, venture capital.
Yeah.
And they're now in Series B, and their data is looking very good. They did all their development in the US. The clinical development, even though the product is being supplied from here. But the fact of the matter is I could not have done it in India. The ecosystem doesn't allow us to do it in India.
I think that's the playbook is very different.
Yes, and Bicara will look at, either spinning off the asset or going to the public market very soon, just because the system supports it, right?
For stories like this, keep following us. From Code to Culture, our podcast. Subscribe to our channel, follow us on social media.